Dr. Collins with the National Institutes of Health. Sitting at my dining room table in Springfield, Illinois, there were about a dozen of senators who had the access to Zoom to be part of that conversation. I felt like I was privileged to really hear some information which most Americans wanted to hear. And I knew it had to be important for them to ask for a briefing in the middle of the week. What they were talking about during the course of that hour was variants. What's happening to this coronavirus as it replicates over and over and over again, millions of times? And what they told us, and I'm a liberal arts lawyer, so I don't profess any special medical expertise here. What they told us was there were dominant variants that were starting to emerge. And they told us the shorthand description that they used in the laboratories. I just remember the first one was the UK, United Kingdom variant. They said by the end of March, that's not that far away, 4 weeks plus, by the end of March, it will be the dominant strain of coronavirus in the United States. I was taken aback by that, to think that a variant could become that dominant that quickly. But it was fair warning that that is about to occur. And then they talked about the South African variant, which is just starting to appear. Good news is they've done enough testing to believe that the major vaccines we are now using across America, Moderna and Pfizer, I have Pfizer, my wife has Moderna, both of them are effective against the UK, United Kingdom variant. Jury is still out when it comes to the South African variant. And there is a third variant, and I won't venture into trying to remember exactly what that was about, but I remember it had some origin in South America. I heard that news and I thought to myself, this is an ongoing battle. We haven't run up any kind of score against this coronavirus. We can't sit back and relax. We're in a very busy third quarter trying to vaccinate America and watching for each and every new threat. So in that circumstance, if you were President of the United States, what would you do? Well, President Joe Biden, decided that we needed to be aggressive. We needed to face reality, not only the 500,000 Americans who have died, but we need to put together the tools to fight this coronavirus as we know it and as it is likely to evolve. He needs an army to do that. It's that big a war. And he came to us with a proposal to start that effort in a substantial way under his leadership. He calls it the American Rescue Plan. And I hear my colleagues come to the floor and really raise the question as to whether this is needed. I just heard the speech of the minority leader, Senator McConnell. But what President Biden wants to do to deal with this pandemic as we know it and as it is likely to evolve is to provide $20 billion more for a vaccination program. Does anyone doubt the need for that? I don't. I think it's the key to getting America back into business. $50 billion for testing, lab capacity improvements, and genomic sequencing of this virus mutation. Again, I am not an expert in science, but it seems perfectly reasonable to me after listening to Dr. Fauci and Collins to make that investment right now. He wants to invest, President Biden asked to invest in 100,000 community health workers to help with the vaccinations and contact tracing. 100,000. It seems like a lot in a nation of 350 million. I'm not sure it's that overwhelming a number. Fund the community health centers so that they will be able to tackle this issue and particularly address the issue of health disparities. Use the Defense Production Act and provide $10 billion for America's manufacture of the key equipment we need to fight this pandemic and the next one, God forbid, whenever it may be. To expand health care coverage for Americans in this time of pandemic by subsidizing COBRA coverage. What is it? I learned the hard way over that break as well that we are ignoring the opioid crisis in America, but it is not ignoring us. It is dramatically increasing, primarily because we are not devoting the resources to it, and the mental health situation of many Americans is aggravated by isolation and social distancing, and addiction is even worse. So I've just described for you the health side of President Biden's American Rescue Plan. I'd like to hear any of my colleagues on the other side of the aisle argue with me. I'm ready to take them on, that is not needed. Of course it's needed. It's needed now, and it needs to be an investment we make, because if we don't break the back of this pandemic, we're not going to get this economy reopened again. We're not going to get our kids back in school. We're not going to get to see our grandkids the way we want to, our children, our grandkids. And we're not going to see America return to what we all desperately want it to return to. The reason I raised that this morning is when I heard the senator from Kentucky raising skeptical observations about this plan, I thought back, it was a year ago. It was a year ago on the floor of the Senate, nothing short of a political miracle, that the first CARES Act under President Donald Trump, the first CARES Act, passed this Senate with an overwhelming vote of 96-0. That doesn't happen much around here, even for resolutions on motherhood. But 96-0, bipartisan support for the relief bill proposed by President Trump and the Congress in March of last year. It was a good feeling, and we knew we had to do it. We were in it together, and we knew we had a challenge. And then came last December, just a few weeks back, and again under the Trump administration, a proposal for a $900 billion relief bill for COVID-19. It passed the Senate with 92 votes. 92 out of 100 senators. It just showed the bipartisanship that we mustered, thank goodness, when we needed it, because the nation needed it. And we did it together. 96 in March, 92 senators in December. We stood behind that plan, even though it had the blessing of a president of a different party at a controversial moment in history. We stood behind it because the American people needed it. Now comes President Joe Biden 5 or 6 weeks into his presidency and says, let me take my leadership opportunity and responsibility seriously, and let me come with a $1.9 trillion American Rescue Plan. Where is the bipartisanship that we saw last year? And I do want to dispute the conclusion of Senator McConnell when it comes to the state of the economy. I did take a few economics courses, don't profess to be an expert. Let's listen to someone who is. Federal Reserve Chairman Jerome Powell, in testifying on Capitol Hill. What did he have to say? Well, he told us that we're in a situation that is far from over. We have an economy that's still challenging. Here are some things that were left out of the rosy analysis by the senator from Kentucky. There are still 10 million more unemployed people than before the pandemic began. 10 million unemployed American workers. While many parts of the economy have recovered, Chairman Powell said, the unemployment rate for the lowest paid quarter of the labor force is probably above 20%. Above 20%. There's a long way to go, Chairman Powell said. Economic activity rebounded in the summer after much of the economy reopened from spring shutdowns, but that momentum slowed substantially, in the words of Chairman Powell, with sectors that rely on person-to-person contact, like hospitality, entertainment, enduring the worst blows. That burden has also largely fallen on low-wage workers, Black and Hispanic Americans and other minority groups, Powell said. I don't believe we're out of the woods yet. I believe we've got a long way to go. The American people believe that too, and President Biden believes it. And when he starts talking about getting us back on our feet, he is suggesting extending unemployment insurance programs that expire in just 2 weeks. March 14th, unemployment programs will start to expire, and he wants us to move quickly to make sure that doesn't happen. And I support that effort for 2 reasons. First, it is humane. We are talking about fellow Americans out of work through no choice of their own. And secondly, putting money into unemployment benefits for unemployed workers is the single best investment when it comes to revitalizing economy. They do not turn to the Wall Street Journal when they receive those checks. They turn to the mailbox and try to figure out how they're going to pay the rent and pay for the food on the table. They spend the money. That's what unemployment's all about. And so to have the other side question President Biden's proposal to give unemployment benefits beyond March 14th really says that they're turning their backs on millions of Americans who have no place else to go. Oh, there's a fear on the other side. We just may be paying people too much, you know? If you give them a little too much money in unemployment, they just might sit home and binge on Netflix and chocolate-covered cherries. Well, I suppose that's always going to happen, no matter how you write the laws. But I think a lot more of American workers. I believe they want to get back to work, anywhere near the salaries that they left behind. And I think they're desperately looking for those opportunities, and we ought to help them in the meantime keep their families together. Emergency paid leave is still an absolute necessity in light of this coronavirus and the way it deals with us. And I want to also make a plea here for the minimum wage. And I know there's some controversy associated with it. Mr. President, you're glad to have you, new to the Senate. Back at that desk there, a fellow named Ted Kennedy used to stand. And I used to love to come to the floor when Senator Ted Kennedy of Massachusetts would give his speeches. When he got into it, he was amazing. His booming voice could be heard all over the Senate chamber, and I never heard him more energized than when he argued for increasing the minimum wage. And oftentimes he was a lonely voice. There were no proposals before us and none likely to appear. But he never failed to come to this floor and remind us on a regular basis of how we had failed year after year after year to increase the minimum wage. And he would tell the story of people in America getting up and going to work every single day, sometimes 2 jobs a day, to try to keep their families together and still qualifying for food stamps and assistance from our government. And he'd ask us when we were going to give them the dignity of passing an increase in the minimum wage. I can still hear him thundering across the chamber. You wouldn't want to be in place if he was arguing a different position than one you held, because he took it over. I don't have that skill. I wish I did. I'm glad to have seen him use that skill so effectively to help people who were just doing their best to get by and struggling. How many times do all of us give speeches about inequality in America and why we've got to do better for the working people? We do it all the time, and everybody knows it's a fact. Wages in America and salaries have not kept up. People at the top have done quite well, thank you, but those at the bottom have struggled to get by. Try to make it on $7.25 an hour. I was trying to do a calculation earlier, what that was. Is that $14,000 a year? Is that $1,200 a month? Is that $300 a week? Could you make it $300 a week? I'm talking about everything now. I'm talking about rent and mortgage and car payment, food, utilities, the basics. I couldn't. I don't know how anyone can, and most can't. They fall deeply into debt and into despair. So when President Biden talks about us reopening the conversation about our federal minimum wage, it is long overdue. Long overdue. And it's an easier issue for me than some because our governor, J.B. Pritzker, when he took over in the state of Illinois, set us on course to reach $15 an hour as a state over the same period of time that Joe Biden has suggested by 2025. I just want to say that those people that are really struggling with the notion of increasing the minimum wage, in all fairness, really ought to think about the people out there who are struggling to get by week to week and month to month. There's another proposal that's in this bill that is currently being debated, and it's the $1,400 addition to the cash payment for many families. I put it in the same category in order to restore equity and opportunity to a lot of people who otherwise wouldn't have it. This is the second installment. The first was $600 in the bill we passed last December. this $1,400 payment will help many families. I want to add one element, too, that was debated a few weeks ago. And Senator Todd Young of Indiana, whom I respect and who is a friend, had offered an amendment in what was known as a votorama as to who would qualify among children who would receive this $600 child's payment. I think the payment amount has been increased in the latest Biden proposal. But the point I tried to make, and I think he and I agree on, though I won't speak for him, is that if a child legally in America, a citizen of this country with a Social Security number, lives in a household with parents who are undocumented, they may be working and paying taxes with something called an I-10, but that child should not be discriminated against or at a disadvantage because of the parent's immigration status. If the children qualify, the children should be receiving those payments. I believe the House bill, reconciliation bill, does that, and I hope that any measure that we consider will do the same. So let me close. I see Senator on the floor who is asking for an opportunity to speak. Yes, I support the American Rescue Plan. Is it possible that I would have written it differently? Yes. Are there provisions I would change? Yes. But I want to tell you, when we passed the CARES Act and the measure last December, that was true as well. We are at a time of a national challenge and a national crisis. We have a president who is facing it squarely, taking it on, accepting responsibility, and asking for our help. Can we do anything less? Mr. President, I yield the floor. Suggest the absence of a quorum.
The clerk will call the roll.
Ms. Baldwin.
Mr. President, I ask the quorum call be suspended.
Without objection.
I have 8 requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders.
Duly noted.